Hello, this is Dr. Paul, and welcome to sunny Florida. I hope you're not in a state that is snowing right now, because your joints will be aching. And today, what we're going to talk about is actually painful joints, especially people who have mild to moderate osteoarthritis, and mostly the knees and the shoulders is what we're going to concentrate on today and figure out when you all need joint injections. Well, you can't just go to the orthopedic surgeon and demand that the joints be injected so you can go on with your way, because you got to fail a bunch of stuff first because A, your insurance company said so. And if you don't do it, they won't pay for your joint injections. And B, you have to fail 6 to 8 weeks of physical therapy. And that really does help because probably 80% of the time, these pain actually got better after they teach you how to stop irritating the joints that causes the pain and then get you to do these non-impact exercise instead, which is safer for your joints. And so if you change your lifestyle and you exercise the joints so the muscles get tighter and takes over the weight-bearing function of your affected joints, you'll be so much better. And of course, you all have to understand that if you are heavy and obese, it's going to put all sorts of extra weight on your joints and cause all sorts of problems. Losing 10 pounds actually reduces the arthritis development by 50%. It's very effective. And if you get your weight down, your pain actually goes away. And of course, you got to show your insurance company, and that it's a reasonable thing to do, that you try arthritis cream over the counter, anti-inflammatory over the counter, and a lot of people like to take glucosamines and curcumin and whatnot. And you fail all that, and you have a great physical therapist for 8 weeks, and you change the way that you do your exercise, and it is time to go back and see your orthopedic surgeon. And then they will say, hey, I need to give you a shot today. Now, which one are they going to go for? Well, the most common one is the corticosteroid injection, otherwise inject directly to your shoulder or your knees. And it by steroids, it decreases inflammation. You feel better in a few days. It lasts up about 6 months or so, and then you have to have another one if it flares again. And if you're lucky enough, you might not have another one for a year or two. So that is the way to go, and everybody agrees with that. Now, some of the doctors might say, hey, how about because you have mild to moderate arthritis, I can inject the joint lubricant called hyaluronic acid for you, and it helps the joint moving better, and it also lasts about 6 months. The 2022 review really, unfortunately, show very minimal benefit as compared to corticosteroid injections. So you do need to know that. But interestingly, Medicare do pay for that still. Okay. So say, for instance, you get yourself the steroid injection and it didn't work. So you went back 6 weeks later to see orthopedic surgeon. And now you should consider what we call platelet-rich plasma injection. Now, what does that do? You go to the lab, they draw the blood out of you, they spin it down, and they take the milky white stuff on the top, which is what we call buffy coat. There is where all the anti-inflammatory goodies are situated in your own blood, and they spin it down so they could make it very concentrated for you, and then inject it into the joint that's affecting you, whether it's knee or shoulder, and it really does decrease inflammation and pain. It improves all your joint motions, but it does not make your joint grow better. Okay, so it's really for pain and inflammation, and it lasts 6 to 12 months now, which is longer than what the steroid shot would do for you. And this one really does help, and it has very little side effects, and you can't have any major reactions to that because it's coming out of your own blood. So this is something that is actually offered by a lot of orthopedic surgeon offices these days. The the other one, which is even more actually useful, but this is the future. Unfortunately, right now, nobody wants it because you have to go into an office and have your bone marrow done and get the aspirate out. And of course, the aspirate contains all sorts of good early cells, stem cells, really, that is very anti-inflammatory. And so you inject that, it decreases inflammation big time, and it may actually repair some of the cartilage. Unfortunately, the FDA still has not approved it, but a lot of offices are doing that on the side. And the reason for that is it is really, really more effective than the platelet-rich plasma. But unfortunately, you got to have a bone marrow, which is not comfortable at all. Now, the Europeans can take the aspirin and spin it down and concentrate it more, so you have a better effect. It may last more than 12 months or so. But since the FDA don't approve it, Medicare won't pay for it, it's going to cause some problems with finances for us Medicare folks. Okay. And the last one, which is I put it there so that you know what's coming, and that is that if you really want to get great amount of growth factors, then you go to the placenta, and then you collect the amniotic fluid and the products and spin it down, and it probably has the best results so far, but the studies are a little bit small. And the duration is that you have relief for more than 12 months. And the reason it's never going to be approved in this country for now is because how are you going to make sure that the fluids that you collect is clean, that it's not infected, etc., from hepatitis, from AIDS, etc., etc. So this is totally not approved at this time. And I just want you to know it's out there. You hear about it, run away from it. Do not go to Mexico and get those things done. It is not safe. All right. So that's all I wanted to update you on the kind of shots that's offered for people whose joints are not bad enough for replacement, so that you can make an informed decision of what kind of shots you need. If you have any questions, send me a message. And if you like what you hear and thought it was very helpful, recommend this to your family and friends. And next week, we're going to talk about junk food and how do you ditch them. Thank you again for your attention, and we will be seeing you again next week.